Afternoon, everyone. Welcome to our roundtable discussion with Congressman Crow. We're looking forward to talking about just some of the current issues, especially issues that impact us as a community. This is Black History Month. So I'm so excited that we're able to talk about current events and how we can begin to address some of the issues in the Black community. And before we get started, we want to open it up for some opening remarks from Congressman Crow.
Yeah, thank you, Omar, and thank you all to all the leaders here who are joining today. As Omar mentioned, the point of this is just for me to continue my learning process. I'm somebody who believes that we each walk individual paths, and those paths are different. We bring different experiences, different strengths, and different blind spots to every job we do. So as leaders, I think our leadership journey should be informed by a constant learning process and recognizing that we are all trying to become the leaders that our community deserves from us. So in furtherance of that project and in that spirit, we wanted to bring this together, and we're doing this a little bit different. The first time we've done a roundtable and a webinar, so bear with us. The technical aspects do or do not work. We have a great team. I think it's going smoothly, but we're trying something a little bit different to open it up to the community and to have a broader audience than can fit into this conference room. So with that, let's kick it off.
Well, let's kick it off. And as we know in the African American community, faith is very important. And we would love to kick this off with a prayer from Dr. Mills.
Well, Black History Month. Before we pray, we have to acknowledge the land in which we stand, the homeland and unceded historic territory of many Native American nations, and Ute tribe, the Utes. They're the longest continuous indigenous inhabitants of this land. So we acknowledge them, and we acknowledge the monumental development of this land on the backs of many lives. Let's pray. Gracious and kind Father of all mankind, we approach you today as humble as we know how. Please acknowledge and accept our words, that we search to articulate our gratitude for all that you've done for us as a people. We invite your presence and your guidance in every word that is spoken, every deed that's performed this day. We're indeed grateful for the years of struggle. We're still here after all said and done. We're grateful to be a tool to tear down bigotry and hatred. There's been times when we've struggled, but God, you've taken us this far. As we pray today, we continue to move on. Also share a prayer from a prayer found on a piece of wrapping paper in Reverend Brook, the largest concentration camp for women in Nazi Germany. It reads, "O Lord, remember not only the men and women of goodwill, but also those of ill will. But do not remember all the suffering they have inflicted upon us. Remember the fruits we brought. Thanks for this suffering, camaraderie, our loyalty, our humility, the courage and generosity, the greatness of heart has grown out of this. And when they come to judgment, that all these fruits that they have borne be their forgiveness." And we pray in your name. Amen.
Amen. Thank you for that beautiful prayer. We have an amazing panel here today. I'm gonna have them introduce themselves, their name, the organization they represent. And then after that, I'll discuss the format and we'll dive into our first question. Dr. Mays, since you opened us up with a prayer, can you also give us a brief introduction?
I am Dr. Thomas Mays, pastor of the Living Water Christian Center, president of the Greater Metro Denver Ministerial Alliance, and first vice president for the NAACP for Colorado, Wyoming, and Montana.
Are calling it me?
It's yours, it's all you.
Okay, hi, everybody. I'm Danny Newsom, and I am the Director of Strategic Partnerships for Cobalt, and we are a reproductive rights and access organization. And I am so honored to have been asked to be here and thrilled to be here, notwithstanding traffic.
Hello, everybody. My name is Dr. Ann Kiki. I am a mother and and also the current president of your Board of Education. Honored to be here.
Hi, everyone. I'm Nelson. I use she, her pronouns. I'm the political chair for Colorado Black Women for Political Action. Born and raised here in Colorado and happy to be here. Hello, my name is Annette Bowser. I am the founder and executive director for Ladies of Value, which is a mentor program for girls in schools, and the current president of Urban League Young Professionals of Michigan, and a constituent who votes for disability.
My name is Omar Montgomery, president of the Aurora branch of the NAACP, and happy to be here with everyone, happy to be with this panel. For those who are in the audience, as we go through the questions, our panelists will answer first, and then Congressman Crowe will chime in on some things that are being done at the congressional level to address many of these issues and topics we're going to discuss today. Dr. Janice Mackey just joined us. And Dr. Mackey, the only thing we've done is introductions of our name and organization. Dr. Mackey, do you mind introducing yourself?
Absolutely. Good afternoon. Apologies for the delay. Dr. Janice Mackey, co-founder and CEO of YASPA, Young Aspiring Americans for Social and Political Activism, and lead organizer of the ABC Collective.
Wow, thank you. So once again, we have a very powerful panel here today. And we're going to go ahead and start with the first question. Now I'm asking the question to myself, which probably doesn't make sense to the audience. But the first question is about homelessness and affordable housing. This is a two-part question. How can you help train people experiencing homelessness and create programs that will prepare and support them so they can get back in the workforce? How can we make housing more affordable and accessible in our community? And, you know, there's some great work being done in the community that sometimes don't go recognized. Ready to Work right there off P25 in Parker, where you have a model where people are able to live, they're able to earn income, and then once they're done, they've generated enough income to put a down payment on an apartment and also have a job. Restoration Christian Fellowship has a safe parking program, as well as a tiny home community with wraparound services so that individuals who are unhoused, they have different levels of services there. Our Veterans Hospital, I hear there's a lot happening in the veteran community, and many cities have said, if we're able to help our veterans out, that's over 25 to 30% of our unhoused population. Family services are important because we have families that are unhoused, not just individuals and families. And we need more resources for families. In regards to affordable housing, to me, we need entry-level housing for purchase. Whether that's condos, whether that's townhouses, and what does that look like? And I think that's going to take our federal resources, our state resources, and our local resources as we begin to look at land and locations where these homes can be developed. Congressman Crowe.
Yeah, well, I couldn't agree more with you on those points. And we can't talk about the homelessness issue without talking about affordable housing, right? There are different sides of the same coin, and the fact that housing has become unaffordable for too many Coloradans, right? The ability to actually get into an entry-level home, to purchase a home, is out of reach for most young folks, actually. When I talk to, they just literally cannot afford to buy a home. And in a country where wealth is primarily generated in retirement, is primarily generated through home ownership, right? Most people's biggest investment in their retirement security is through home ownership. That's out of reach for our young folks now, in the same way that it was for prior generations. That is an enormous crisis brewing. And there's a couple of things here. One is the lack of housing stock. Right? We just actually don't have enough housing stock. So increasing things at the federal level, increasing things like the low-income housing tax credit. Because in Colorado, we build most of our affordable housing using this low-income housing tax credit, which is a federal tax credit that builders use to offset the costs. So I'm part of a bipartisan effort to expand that credit, the amount of money that's available under it, the utilization of that credit to increase the housing stock. That's number one. Number two, you also can't talk about housing and the lack of affordability without talking about the student debt crisis, right? Because these are also tied together. If our young folks are spending large percentages of their extra, net income, $1,500 plus a month to just service their student debt, of course they can't buy a home, right? So that's why debt forgiveness. That's why I've supported the efforts of the Biden administration to forgive debt, but also do things like consolidate debt between public and private debt to fix it to a lower interest rate, are all essential to increase that take-home pay from folks that they can actually get into the market. So student debt crisis and affordable housing crisis are actually tied to one another, in my view. And then the third is the things that I've just been able to just do as a member of Congress. I've been driving money, millions of dollars of grant money to some of the important nonprofits. You mentioned some of them, Omar, the Ready to Work program, the Bridge program in our community. They're actually doing things to stand in the gap and solve for people who are in crisis. Because if people are in crisis, we need to address that and get those folks back into housing, a housing the first model, that then get them the services that they need.
And the only thing I would add is maybe future legislation, either at the state level or at the federal level, on making it easier for people to repair their credit. I think that's a huge issue that people face where they're punished for up to 7 to 8 years on something that was either late or something in their early years when their finances wasn't the best. So I would love to add that too. Let's go to question number
Can I
2.
also add because the credit thing, the other side of that is also the issue of how incarceration records
Yes.
stick with folks,
Yes.
right? And then how, after people have served their time, they haven't served their time, right? And I hear that it sticks with them for their entire life, whether it's voting, whether it's getting credit ratings, whether it's getting housing, whether it's getting jobs. We have to end this life stigma that sticks with folks and prevents them from being able to resume a normal life.
Great.
So what you just said just reminded me of that issue that I hear a lot about.
I think all those issues are important that have to be addressed if we want to start talking about generational wealth and things of this nature as we move forward. Dr. Mackey, mental health and drug use. What are we doing about the rise in overdose and mental health needs? And can you speak to the importance of youth voices on this issue? And how does this also play a part in the rise of youth violence in the community?
Yeah, thank you so much for the question. It's a really big question, and I know we don't have a ton of time. So I'm gonna speak first, do an iceberg analogy, right? So embedded in this question, we're talking about symptoms, essentially, right? So when we think about an iceberg and what we see above water, we see like violence, right, or substance use and things of that nature. What I want to speak to is what's beneath the water, so to speak, what's beneath the surface, what's often invisibilized. And what that is deeply, for instance, a sense of belonging, right? So a lot of the work that we do is providing sacred spaces for our young folks, rooted in identity affirmation, and particularly racial identity development, mental health supports, healing-centered engagement, right? Doing that soul-to-soul work, because that's really much about prevention, right? Why are they engaging in substance use? Oftentimes it's because they don't feel that sense of belonging. They don't feel the wraparound supports. There's not a holistic way of thinking about their well-being, right? Something else I want to address here is social determinants of health. It's really, really important that we have a public health lens on this. So whether that's education attainment, we provide courses at the middle school and the high school level that are gender-based courses, young women of color, young men of color courses for young folks who experience push out, right? So that they can, again, have a sacred space even in their schooling experiences and not necessarily be implicated in the school to prison nexus. Also learning how to do research, like root cause analysis. So we do a lot of youth participatory action research, even as it pertains to substance use as well, so that they can deeply understand the why, but also prevent and mitigate the criminalization that comes with substance use as well. I'm super excited to share some other dope partners as you did as well. I really appreciate that because there's a lot of great things happening in the community as it pertains to this. So Struggle of Love Foundation, Second Chance, right? Apprentice of Peace Youth Organization, driven by our ambitions. There's a lot of great organizations alongside us doing this work to really make sure that our young people are getting what they need. Along those lines, excited to share as well that we recently won the bid to repurpose Paris Elementary School into a community hub rooted in social determinants of health, right? And so this is going to be a huge uplift for our community. Economically, educationally, we'll have childcare on site as well, workforce development, apprenticeship models, like you name it, right? And we're going to need deep partnerships, right, in order to address what's underneath that iceberg. so that we can really mitigate these symptoms that we're seeing and make sure young people have jobs to go to, make sure that they have the training to get the type of jobs that they desire to have in order to have a living wage, right? So that they can afford a home, right? So that they can afford rents these days as well. So I'm very much excited about that. Something else I'd like to share is we created Healing Flames. And that stands for Healing Families, Lives, Assignments, Minds, Elevations, and Souls. And that's to do the soul to soul work. There's a lot of spiritual fatigue that we're experiencing, whether you're a young person or whether you're an adult engaged in doing this work and creating sacred spaces. And so the purpose of that is to engage in spiritual renewal as well as deepen spiritual fortitude in interracial and intergenerational ways as well.
Thank you. Dr. Mackey, just a follow-up. How important is it to have a central location where youth can go as we address these issues?
I appreciate that follow-up question because we work with so many young folks and families that are seeking refuge, right? So to be able to have a brick and mortar where they know where they can go, they know they can actually knock on the door and somebody's going to be there, is going to be huge. And especially for it to be a one-stop shop, right? Our vision is that it is about collective power and collective impact so that we're able to cross-pollinate, right? And that folks don't have to go to 5 different places in order to get their family's needs met.
Is that the idea behind the effort at, what would be the repurposed Paris Elementary building? Is that the goal there?
Yeah, we're super excited about it.
Yeah.
Yes.
Yeah, can I ask, I'd love, Dr. Kiki's perspective from the school element, right? Because I know the schools are overwhelmed with this issue, right? I hear time and time again that more and more of the effort and resources are focused on mental health here. What are you seeing?
Most definitely, the schools are overwhelmed in terms of drug use, in terms of violence. I believe just last week, APS lost another student, right? And there was violence on the street between two former students of the same school. We see it over and over. I cannot begin to tell you the different emails that we receive on the back end from our superintendent talking about this kid is gone, now that kid is gone due to most of the time violence. But what in APS at least we're committed to do is continue to provide mental health services. We partner with organizations like Hazel Health, right? And I appreciate the folks at Hazel Health always circling back to board members and letting us know what they are doing in terms of giving services to our students, because we also know that overall mental health is absolutely overwhelmed, right? So they're coming on the back end and helping. In that same vein, we also know that our teachers are also overwhelmed. We the board are trying to push for the same service for our teachers. If they can regulate, if they're in a better place, right, they will be able to educate our students and give them that reinforcement that's needed for them to be in a classroom. So APS is definitely not as strange to that, and we continuously under the delegated authority of the superintendent to brainstorm about more and more services that we can provide in terms of mental health. One thing is for sure, every time there is an issue within the schools or outside of the schools, right, or in the premises of the school, we make sure that the community knows that there is mental health services that they can tap into. That is very well communicated to these communities.
That's really helpful.
I just want to say thank you. And did you want to have any follow-up with that? In regards to just what is being done at the congressional level when it comes to youth?
Yeah, I'd be happy to address one of the biggest. Well, I mean, there's so many parts of this problem. It's so complicated, right? And there are so many different aspects to address here. Well, one is cultural, right? And in the cultural, in terms of how we treat mental health, how we view it, the stigma actually ends up driving funding in our policy, right? So we have this perspective that, oh, there's healthcare and then there's mental health care. We treat it differently, right? Instead of just being like, it's healthcare, right? The mind and the soul is a part of what makes a healthy person, right? So we bifurcated mental health care into its own category. And by policy, we literally have as well, right? So the federal government, when they reimburse mental health care providers, particularly those that provide urgent inpatient care at lower rates, right? The reimbursement rates through CMS, through the Center for Medicare Medicaid Services, have gone down, right? So as a result of that, mental health care providers and those that provide inpatient services for those who are in the most acute crisis are shuttering. Like we've lost hundreds of beds in the state of Colorado over the last couple of years. So at the same time as the crisis is increasing, the need is increasing, our capacity is decreasing. So we've been working to try to get those reimbursement rates back up and on parity with the rest of healthcare so that there's actually an incentive to providers to open up treatment facilities, to have acute care and to make that available. So that's a big part. And then we're driving funding. So I helped get some funding to a new model that Cherry Creek School District is working with now, and that is a new day center.
The Traverse
Cherry Creek,
Academy.
Traverse Academy, right, which just opened up
Yes.
this year. So we were able to get a bunch of money for Traverse Academy and help build that out. And that's a model that I think it holds great promise for other school districts to replicate. And if it's successful, then we can try to drive funding in other schools. And essentially what it does is when a student is in crisis, that student can get care, and instead of immediately being put back into the student body, they have an alternative place to go to ease them back in and to make sure they're where they need to be before being jumped back into the big pond again. So something I'm really excited about.
I'm gonna say this, we have 30 minutes to cover about 5 more topics. As moderator, as moderator, I want to say that.
Our eyes are always bigger than our stomach.
So just to make sure we're able to at least touch these topics, I also want our audience, if you're in the chat, you have ideas, please email the congressman. I'm sure they'll be in the chat because we know that there's other community members doing great work, but we want to go to Dr. Kiki Moore. Immigrant and refugees are coming in, and actually when this RSVP went out and they talked about what are the issues, this was one of the top issues that came up. What is being done in the community and in the school districts to address the increase of immigrant and refugees that are coming into the city and in the school district?
Absolutely. As you know, in my introduction, I did mention that I am an immigrant, though proud American. I came here in 2001. I came here seeking for better opportunity, educational opportunity, living opportunity, all of that. And hey, I have to say that maybe if I had gone back to my country and wanting to be in local government or in government at all, it would have been difficult for me as a woman, right? I do acknowledge that. I am very empathetic with the newcomers. I don't know if I like the term migrants or whatnot. I know I am an immigrant, but I don't want to call them immigrants, right? Because it's a different term. So I am very empathetic about the newcomers. And if you followed a little bit of local politics, I think Mayor Mobilati of Colorado Springs has expressed that very well in terms of being empathetic with them, who also is an immigrant, right, from Nigeria. The governor on Thursday did mention at the American University during one of his addresses there that fixing the immigration issue is not difficult, because we know that Republicans and Democrats agree on that. It comes to Congress. Congress needs to step up a little bit But let me tell you what we are doing at the local level in our different districts. We have 178 districts in Colorado. And Colorado being a blue purplish state is receiving a lot of these opportunities, human opportunities, right? The five, I can tell you the 5 urban districts are being impacted at a high rate. Believe it or not, APS has received between July of just this summer, right, July, and now, I have not checked the new numbers yet, but between July and 2 weeks ago, 2,000 new kids. There are some schools that are at capacity. We don't know what to do. It's not just an issue of funding. Yes, funding is important, and I'm using my leverage, talking to different representative, political, legislative people on the back end, because I will not be silent. These kids deserve an education. They are already here. We need to do something for them, about them. What is being done? The education, the funding part is, I think it's coming to terms now. I believe the governor is hearing those outcries about after October count, we have received X number of kids and we don't have enough funding for them, right? But what about their educational opportunity? How fair are we when we talk about sitting those kids for testing? Because that's how the system works. So these questions are being raised as well. Should we take those babies that are coming brand new into this system at the elementary level and say, go take the CMAS test? Or should we give them a year or two to be able to acclimate themselves? Should we take those middle schoolers or those high schoolers who probably still don't speak English very well, though they could defend themselves, they know enough to be dangerous on the street, and say, go and take the PSAT or go and take the SAT, and let's see if you are qualified for college. Is it fair? So this is my new battle. How is that impacting? How is that educational piece impacting the performance, the improvement of the districts? Because whether we like it or not, the system is going to do what the system does. It is up to the folks like me to advocate. So that's what we're doing. But we're excited for this new opportunity with these newcomers, and we want to see what's next.
I love the welcoming and the humanity behind the
Thank
language
you.
outside of the passion. So thank you for sharing the terminology we should be using as well. Congressman Crowe, it sounds like those are some marching orders.
Yeah, no doubt, no doubt. Well, in case, it's no secret that Congress has not been crushing it recently on productivity, right? But, it's a real problem, frankly. It's a huge problem, right? And I'll address that in a minute. But the first thing I wanted to mention, and you started this, Dr. Kiki, is one of the things I'm most proud of is the fact that this is a community of immigrants and refugees, right? 20% of the people that I represent were born outside of the United States. Right, and it makes us stronger. It makes us more vibrant. It makes us a better community, and we have to start the conversation there, because you just have to you drive down Colfax, Havana, Peoria, any of these main places in the district, and you see the businesses. Right, these are businesses, many of them that are owned and run and founded by immigrants and refugees. Right, these are small business owners. These are people who come here to work. Right, and come here to build lives. So that's the first thing I'm going to say. And the second is, you mentioned this, the school account issue, which the state needs to get their arms around, right? Because we do the head count in October, and we've had this influx of newcomers since that time, and that's largely been, frankly, in Aurora and Denver. So those are the two districts that are going to be the most impacted by that disparity. The fact that there's a lot of new children that are in the system that were not accounted for in the October count. And that's, I know, an issue that the governor and the state legislature have to address and are working to address. And then, listen, I've been pushing for comprehensive immigration reform since I started this job 6 years ago. And one of the most important things we can do, there are things of great disagreement in Washington on, but if we want to immediately make a huge difference, we just provide work authorization, right? Just allow people to work, right? Because that solves a lot of problems, right? It solves a problem that we have a workforce shortage. We literally don't have enough workers. We're at historic lows of unemployment. You visit, businesses and they say, we need more people. Every business says that, right? So we need more people. We have more people, but we're literally not allowing them to work and support their families. And you go talk to them and like, we don't want a handout. We just want an opportunity to work. So let's give them that opportunity. That's the thing I'm pushing the most down in Washington.
Well, thank you, thank you. Ms. Nelson. Oh, Ms. Nelson. I'm sorry. I am. When we began to talk about the high level of mortality rates among Black, we talked about disparities in the healthcare system to address that issue. What is being done in the community and what do you feel needs to be done so that we can overcome the disparity of Black women not having access to healthcare or healthcare is not meeting?
Yeah, so in terms of especially Black maternal health, in Colorado, according to the Department of Public Health and Environment, Black women are twice as likely to die during pregnancy or within 1 year postpartum than white birthing people in our state. And Indigenous women are even higher, it's 3 times more likely. A key tenet of reproductive justice is that people who want to give birth and raise children are able to do so healthily and safely and raise them in safe communities where they have the resources they need to thrive. So in terms of the Black, and our trends here in Colorado for Black maternal mortality mirror national trends as well. So we're seeing this across the country. So some ways that we can tackle this, I'll try to make this quick. It's a multi-pronged issue. I think one of them is investing in different types of care and models of care for Black women, especially when we think of midwifery care. In the US, we have the highest maternal mortality rate of developed nations. And countries that have lower maternal mortality rates really put an emphasis on midwifery care and all types of midwives, not just certified nurse midwives or certified midwives, also certified professional midwives who are specifically trained in providing care in home birth and community birth as well. So making sure that we're investing in all types of providers, doula care as well. There's a big wave across the country of doulas being able to be reimbursed by Medicaid. Colorado, that will start July 1st of 2024, which is really exciting. Making sure that in that the reimbursement rates are up to par, right? That there's parity and that they're able to receive a living wage so they can provide the care, especially community-based doulas. Group-based prenatal care as well has been shown through research to be effective, especially for Black women, to have positive maternal health outcomes. So making sure that our Medicaid infrastructure is investing in and reimbursing for group-based prenatal care as well. Another is access to healthcare coverage. I'm a health policy nerd. That's like my focus. And I'm big on making sure that folks can access affordable coverage. So making sure that they're able to receive the services that they need. If you don't have healthcare coverage, how are you going to pay for any services you need? But also on top of that issue, we need to think about how 25 out of 64 of Colorado's counties are maternity care deserts. So that means that they lack easy access to maternal health provider maternity care. And we're seeing a wave of closures of birthing centers across our state, especially freestanding birthing centers that aren't affiliated with the hospital system. And these centers really often amplify midwifery care and rely on midwifery care. And so when those are closing, it just even exacerbates the issue for Black women. So making sure that we're, right now there's a bill being led by Elephant Circle and Soul Sisters, who are two birth justice organizations in Colorado, to study maternal health care closures and integrate CPMs or certified professional midwives into our maternal health landscape. So investing in things like that. I think we need to think about, research has shown that cultural concordance in care. So when a Black woman is receiving care from a Black maternal health provider, that it yields often better health outcomes for that person. So making sure that we're investing in pathways for Black women to serve Black women giving birth. Stackable credential pathways, community colleges, scholarships to become a credentialed doula or a trained or a licensed midwife. I think we need to make sure we're investing in that and making it accessible for folks and providing financial assistance and wraparound support, childcare, all of that. And then I think on top of that, the social determinants of health, as Dr. Mackey said, making sure that Black pregnant people and postpartum people have access to food, healthy and affordable food, making sure they have access to housing, and of course, health is a part of that as well. But I think, also how we're investing in care for our incarcerated Black mothers as well. That they can give birth safely, because everyone deserves to give birth safely in the end, if they choose to give birth. And they should have the power to choose if, when, and how they want to start families. So making sure that they have access to all levels of care. We have some things happening, like I said, in the community with doula, Medicaid reimbursement for doulas. CPMs will start to be reimbursed by Medicaid later this year. We passed Coverall, Coloradans, House Bill 1289 a couple of years ago that will expand access to Medicaid and CHEP for, undocumented pregnant postpartum people and children starting next year. So we've done, we have under the Inflatable Reduction Act, we have advanced premium tax credits to help people better afford healthcare. We have the congressional level, we have the Black Omnibus that has been going through. The Biden administration released a blueprint to address the maternal mortality or maternal health, I should say. So we have things happening. We just need to make sure that we're centering Black women. When Black women have access to the resources they need to thrive, we all benefit. So, yeah.
Thank you. Thank you.
Sorry, I was talking.
How true, how true.
Well, any one of these topics could and should be its own. So many ways to go, and I think Ms. Nelson for your leadership and touching on. I think just two areas of my focus has been on the pathways, investing in pathways for practitioners, which actually University of Colorado Medical School is trying to do. So I was able to get some funding and resources to a pilot project to do just that, because as you so articulately outlined, it matters who's providing the care and who, whether someone's getting care from someone that looks like them and has the same lived experience as them, and it actually matters a lot for the outcome, and I know that the data show that. So trying to expand that pipeline. Then the Black Health Initiative, Black Maternal Health Initiative, also at the med school, to help train practitioners differently, because the other thing we know to be sure is that when Black mothers are getting care, Black women are getting care, a lot of times their needs and things they're trying to express are discounted by the practitioners, right? There's actually data that clearly show this. I've seen this data that when a Black woman says they're in pain, that literally the practitioner devalues that pain or reduces it, so we have to train practitioners differently. We have to recruit and expand that pipeline. That's something that I'm taking really seriously. So I think we appreciate your help.
Just one more thing on that, yeah, the racism and bias and discrimination is often the cause of these disparities in our institutions and within our healthcare system. Sorry. But yeah, just wanted to echo that that's super important in building those pathways. Yeah, just wanted to echo that that's a big thing, and it also impacts infant mortality. Oh my gosh.
Water.
There's water. Take a moment. Black infants in our state are twice as likely to die as white. So we see that.
Two times.
Yeah, 2 times as likely to die. So we see that mirror those Black maternal mortality rates in our data Black infants.
Just want to say thank you. And this probably means, and when we began to talk about voting, because voting is part of how we get these issues done. We see voter protections under threat. We see that our democracy is. And we see also that the rights of people are. So Ms. Newsom, how we want to address these issues and what's being done by your organization or what you see in the community?
Thank you. Thank you, Mr. Montgomery. But first, I just have to tell Hunter, thank you so much.
Yes.
And when you were speaking, about the role that racism, structural racism plays in Black maternal injury and death and Black infant mortality. I was thinking of a book by Linda Villarosa, Under the Skin.
Yeah.
Under the Skin. It's a fabulous book, but it does just talk about how racism has, in many ways, decimated the health and the health outcomes of African Americans. And so you just said that so well. So thank you. And now on to, democracy. Every 2 years, every 4 years, with the presidential election, I've said this for decades. I date myself. This election is more important than the next. This election is more important. And we are in a period of time where every election is going to be more important than the election we had, because things have changed. The conditions in this country have changed so fundamentally that there's no time to wipe a brow and say, woo, we made it through this election, because the attacks are relentless, whether it's on voting rights, and the attacks are not just from state legislatures, because there have always been hostile state legislatures, always, but now they are aided by the Supreme Court. Although the Supreme Court lately has come up with a couple of decisions that were surprising, but the Supreme Court decimated the beating heart of the Voting Rights Act. And it's not a coincidence that you see hostile state legislature after hostile state legislature, they've been freed. They've been freed to enact voting restrictions, voter suppression restrictions that actually we haven't seen, not that I was around during the post-Reconstruction era, but just for the amount we haven't seen since the post-Reconstruction era. And it's not only voting. We talked about voting, but you see it in book banning, history banning, with particular attacks on Black history, on LGBTQ history. I mean, vicious attacks. And the state legislatures, at this point, those, there are some that are better at it than others, like Texas and Florida, but are literally robbing their students of the ability ultimately to compete in the world, but immediately to understand the world that we live in. Abortion, and it is not a coincidence that those states that are the most hostile to voting rights, to voting access, are also the states that are enacting the strictest bans on abortion. That is not coincidental, because frankly, at its heart, these people are anti-freedom, anti-knowledge and anti-freedom. And so notwithstanding Congress, and it depends who's controlling which chamber at the time, but we had the John Lewis Act. Where is it? And I think we just need to be honest about why Congress isn't doing anything, because we have one party that is dedicated to frustrating any attempts to get work done, right? That's what we have. We've had the Women Health Protection Act. I believe, Congressman Crow, you are a sponsor. As long as Congress is constituted the way it is, we are not going to be able to get help at a federal level. And I'm old enough to remember growing up during a certain period of time where our eyes did look to the federal government. That's where our eyes look to, but now they have to look to the state government. And luckily in Colorado, whether it's voting, abortion care, gender affirming care, we live in Colorado, where we have a state legislature that is controlled by people who care, not just about process, but about health, about science. It matters. We have a governor who will not frustrate those attempts. So what do we have in Colorado? We have the Reproductive Health Equity Act, passed 2 years ago, that made the right to an abortion, or the right to refuse, the right to contraception, or right to refuse contraception, fundamental rights by statute in Colorado. That is absolutely incredible. Last year, in the face of all the hostile legislation being passed by state legislatures, we have the Safe Access to Protected Healthcare that declared that abortion care and gender affirming care are protected healthcare in Colorado and shielding the privacy of both patients and providers. This is amazing. And this year, you know, I got to put this in here. This year, we have a proposed constitutional amendment, which will enshrine those rights in the Colorado Constitution, which just adds another layer of protection. But a right without access is an empty promise. And so what it will also do is repeal the ban against the use of state insurance for abortion care, which will allow state and local employees, firefighters, teachers, park rangers, librarians to use their state insurance, and other people who are on state health insurance to use that insurance for the reproductive health care they need when they need it. So I did have to get to Colorado. Am I over, Omar?
We're good. We're good. We want to pivot a little bit, but can you briefly, address-
Well, I really never have to add anything on to the other. So great, so good. I mean, listen, this is a nonpartisan event, so I won't ever, talk about candidates or political parties, but I do encourage people to vote because the bottom line is, people will say the pluses and minuses of candidates or individual parties, and I understand the frustration, by the way, with our system, right? And maybe we have too much money in our system. There's dark money and super PACs, and we have gerrymandering. We have all these structural challenges to having the more perfect union that we are still striving to be. But we're not solving those issues between now and November. And there are extremely important policy issues on the ballot. So all I do is encourage young folks to just do your research. Do your research, figure out what's important to you. What are the issues that are driving you, and get out there and let your voice be heard.
So we have two more topics. I'm going to ask you two to go back to back and for the congressman to close addressing those two issues that come up. Economic development. We have many small businesses in the city of Aurora, especially when you think about the Colfax corridor, the Havana corridor. And how do we continue to support small businesses and address the wage gap within the African-American community? So, Ms. Bowser, you have all that to cover in about 3 minutes.
I made notes. Passion of mine.
I'll give my closing time to, because it's far more interesting for them to speak here.
I've been a small business owner for 9 years now, which is kind of crazy. I don't feel old enough to say that, but that means I'm getting older. What I've experienced, and I think this answer will go into both of them. How do you support small businesses? The first one is, I will say that Colorado, as mentioned, is a very resourceful state. It is not a lack of resources. It is a lack of access to those resources. What does access look like? To me, it's information. So we've got OEDIT, the Economic Development and International Trade Department of Colorado State, who at one point in time, I don't know where they're at right now, had like $300 million available for businesses, essentially small businesses, and a lot of it was grant money. Well, a couple of years ago, I sat down with 30 business owners who had never even heard of this money, and it had already been available to them for 2 years. So where do we get our information from? Who are the gateholders, the information holders in society, and how do we spread that information to other people, right? I got excited to hear about Paris Elementary, but I was like, how are people gonna learn about it? Like, where do we dispense our information from? Like, how do people know they can go to Paris Elementary to get whatever they need? When everything that Ms. Nelson mentions comes into fruition, how do people know about it? Where are we dispensing our information? Where's our resource hub in the community to dispense that information. So the money is out there, the grant money is out there. And then the other thing is with access is navigation. All right, so now I know where it is. How do I use it? How do I apply for a grant? Where do I, I've experienced in helping other small businesses kind of get off the ground. If I'm applying for a grant, I need to have my books ready. Well, a lot of businesses don't have their books ready. And it's not because they don't want to, it's a know-how, it's a lack of, if I'm a small business owner, usually it's me. So how do I outsource? Because I don't have time to run the business and the back office and the books and the whatever. And I probably also don't have the economic resources to pay for someone else to do those things too. So then as a small business owner, how do I get the help to navigate the system? I would love to tap into the resources. I'm trying to make cakes. I don't got time to navigate the system also. So resources are available, but how do we get access? And then how do we get help navigating the resources that are available to us? And then how do we get set up to be system ready? So those are kind of what I'm seeing the struggle to small businesses is, and I feel like if we can answer those questions, we can better support the small businesses. Then, how do we close the African American wealth gap? 2.5 minutes just not gonna cut it, but I will say, one of the answers is answering the first question. Because this country, was founded on a whole bunch of stuff, but ownership was one of them, and that is still the game. If you can own something, business, property, home, land, you got a piece of the pie. And so business ownership is owning something, home ownership, is another thing. So how do we help these business owners own their business, own the building that their business is in, own the land that their business is on? So how do we work on land? And then of course, wealth gap, you mentioned earlier, Congressman, home ownership is huge. And, I'll voice my beef with affordable housing is equity. Like if I buy an affordable home and I try to sell it, that there's the lack of equity I would be able to get from that home ownership because it has to stay affordable and all of these things holds me back. Same thing with renting affordable housing. If I need to make $30,000 to stay in this home and I get a promotion that's gonna put me at $35,000, I have to decide if I wanna take this $35,000 the $5,000 promotion or lose my home essentially. And the $5,000 difference isn't gonna allow me to be in regular housing. So how do we turn subsidized support into transitional support opposed to limiting support, which is what it currently is right now? I'm comfortable admitting that at one point in time I was on food stamps. Every 3 months I was getting a letter like, you made $18 over the amount of money that you're saying, we're gonna take out for food. And I'm like, well, the $18 I paid over mine is not gonna help me sustain food after I leave my food stamps. Yeah, so it's like, how do we create rules, regulations, and restrictions that allow for transition when we're in subsidized support opposed to just immediate cutoff? Because that's how you close the wealth gap, is you give me an opportunity to transition to a different level of wealth without immediately cutting my legs from underneath me.
So I just want to add, public safety has also been an issue that has come up for entrepreneurs, especially those that have a brick and mortar. I gotta make sure my business is safe. And Dr. Mays, you've been doing a lot of work in bridging the gap between our law enforcement community and the Black community. There's been a lot of different protests, but there's also been some progress. Can you talk about the work that you're doing to bridge that gap?
Yes, well, and I echo everything that's been said, because in our churches, in the big community, we have all of these. Black maternal health is something we're working on this year, April the 12th through the 17th, Black Maternal Health Week. And we've got some things going on to try to bolster that. But where policing is concerned, I think communication is key. And we don't have the open communication that we really need. What we don't understand, is that there is a, faith community, but there is a marginalized faith community which is never recognized. So the marginalized faith community cannot do what the other rest of the faith community can do. And our police department, our cities have a tendency to cherry pick who they want to be considered the faith community. And so they want the faith community that will play softball and not baseball. The average baseball pitcher is right around 95 miles an hour. I think the record is 105 miles an hour. Average softball pitcher is around 72 miles an hour. And they prefer the 72-mile-an-hour pitchers. So when it comes to those who are going to give them the hard questions, they don't consider them the faith community. Faith community, they listen to more or less handpicked softball players. And so our questions are not being answered. What we run up against many times where the policing is concerned, if you just do what's right, you won't suffer this. Well, even if we do what's right, someone told me, we were in a session forum a few weeks ago, and it says, why can't we just let all this go and just, I says, or no, she said, when can we let all this go and just get along? I says, when a young man can walk to the store and get a drink, walk back home without being killed. That's when we can do it. I said, when I can drive down the street, not be pulled over because of the kind of car I drive. And first question, is this your car? I'm driving it, it must be mine. But, so those type of things. So we've been working nonstop since 1990 now. Really working, trying to get the police to understand, know our story. Have the police department say, well, I don't see color. I said, well, then that's the problem. You need to see me, I'm black. You see me black. And so when you see me black, you know, I'm not going to react the same way a white person is. I'm not going to, because we're suffering differently. And so when you approach me, and just because the kind of car I'm driving or your excuse to say, there's someone that looks like you, you've got to report that this has gone on. After a while, that gets pretty old, and it's pretty old. To withhold certain things from, so trying to get that equity in policing is a battle we can't stop fighting. We haven't made the progress we need to make. We haven't made the progress. When it goes to social justice, when we get to court, I have a young man I'm working with right now, dating a white female. They got into an argument, fighting back and forth, and everything is going against him. You know, because, and we hate to tell our black men, stay away from white women. But it's getting to the point that we're doing like my father used to tell us, stay away from white women because of the retribution that comes with it, and it hasn't changed. When we're looking at the faith community and policing, we have to see it even on the federal level. The evangelicals are different than the marginalized faith community. The evangelicals are the ones many times that they listen to, and you see the result of that with the evangelicals following behind untruth. I'll put it like that, where our faith community really wants to work with truth.
Just want to say thank you. Congressman Crowe, we're towards the end of the program. We want to say thank you all. First of all, Dr. Mays, thank you for the work that you're doing on this, because this is a nationwide effort and not just here in Arapahoe County. And the faith community has been at the forefront since the civil rights movement. So we just want to say thank you. That Congressman Crowe, do you want to close us out?
Well, first off, thank you to Omar, as always, doing an amazing job emceeing. Thank you for agreeing to do that, and for leading, and all of you. I learned a lot today, and I'm somebody, I take a different approach to this job, and that I think we are way beyond that point where, you know, leaders are supposed to be the smartest person in the room and come in with all the answers, and you just explain how things are, like, it's just not going to work anymore. right? Our problems are too complicated, too deep, too nuanced for that version of antiquated leadership. So this has to be collaborative. We have to do this together, and you all have pieces of the puzzle and expertise and experience that will help us get where we need to be. So I thank you for that, and for the opportunity to learn from you and to hear and to continue to collaborate. Thank you.
Thank you.
Thank you. And once again, if you're in the audience, please submit your ideas, email your ideas, put them in the chat so that we can follow up with them as we move forward. Thank you, everyone. Enjoy the rest of your day.
Yay.